Welcome to medicinal biochemistry class on proteins and amino acids. So the learning objectives. At the end of this class, the student shall be able to define hyperbilirubinemia, define jaundice, recall different types of jaundice, explain Vandenberg's test to diagnose jaundice. Okay, so bilirubin is the main bile pigment that is formed from the breakdown of heme in red blood cells. The broken down heme travels to the liver where it is secreted into the bile by liver. So serum bilirubin is considered a true test of liver function as it reflects the liver's ability to take up, process and secrete bilirubin into bile. So a small amount of bilirubin circulates in the blood normally. So there are we can categorize this into direct bilirubin, so that is called as conjugated. Indirect bilirubin, so the unconjugated form of bilirubin is called as indirect bilirubin. So total bilirubin constitutes about conjugated bilirubin plus unconjugated bilirubin. So the normal level of conjugated bilirubin is 0.3 to 1.2 milligram per deciliter. So unconjugated bilirubin should be less than 0.4 milligram per deciliter. So we know that the conjugated bilirubin is that is bilirubin conjugated with glucuronide, that is bilirubin glucuronide, and unconjugated is protein bound usually most of the times, and conjugated is soluble in water and unconjugated is insoluble in water. Okay, so the normal total bilirubin value should be between 0.3 to 1.2 milligram per deciliter. Okay. So when the concentration of blood bilirubin is more than 1 milligram per deciliter, the condition is known as hyperbilirubinemia. So jaundice, so this refers to the yellow color of the skin and sclera, so that is caused by deposition of bilirubin due to increased bilirubin levels in the blood. So although this jaundice is not a disease, so it is a symptom of an underlying disorder, be it an infection that is damaging the liver or due to obstruction in the bile duct. Okay, so this condition where the sclera is yellow color or the skin turns yellow due to accumulation of bilirubin is called as jaundice. So serum bilirubin is the excretory product, and so this is formed by the catabolism of heme we have seen in the previous class, and there are two types, that is unconjugated, which is insoluble in water, and conjugated, which is soluble in water. So the estimation is carried out by a method known as Vandenberg's reaction. So the reagents required for estimation of bilirubin is diazotized sulfanilic acid in hydrochloride plus sodium nitrite and methanol. Okay. So when diazotized sulfanilic acid reacts with bilirubin, it forms azobilirubin, so which is a purple colored product. So when there is an bilirubin more than 1 milligram, so then the color, it gives the color immediately. So that is called as direct positive. So direct positive indicates the presence of higher amounts of conjugated bilirubin. So indirect positive indicates the presence of higher amounts of unconjugated bilirubin, and here the color will appear only after addition of methanol. Okay, so only after addition of methanol it will form a methanol conjugation, then it will react with Vandenberg's reagent and it will form azobilirubin. So if the serum contains both higher levels of conjugated and unconjugated bilirubin, immediately after addition of Vandenberg's reagent, so it will give purple color, and on addition of methanol, the purple color further intensifies. That result is called as biphasic, indicating the presence of higher levels of both conjugated and unconjugated bilirubin. Okay, so serum bilirubin. So here, what is the significance or application of this Vandenberg's test? Okay, so unconjugated bilirubin, So Vandenberg reaction is indirect positive. So that is the result. That is, as soon as you add Vandenberg reagent, it does not give color, but on addition of methanol, it gives color. So it indicates of prehepatic or hemolytic jaundice. Okay, so that is an indicative of prehepatic or hemolytic jaundice. So this is mainly because of breakdown of RBCs. And so here, so the causes is neonatal jaundice, sickle cell anemia, thalassemia, Gilbert syndrome, Kliegler-Nager syndrome, and mismatched blood transfusion. So if the bilirubin, if the blood contains both higher levels of unconjugated and conjugated bilirubin, so the result is biphasic. So the jaundice is called as hepatic. So the causes of hepatic jaundice, so that is mainly because of damage to the liver. So that might be because of viral hepatitis, alcoholic hepatitis, or drug-induced hepatitis. So if the circulation contains higher levels of conjugated bilirubin, it gives direct positive results. So the class of jaundice is called as post-hepatic or obstructive jaundice. So this is mainly because of some obstruction in the biliary tract. So due to gallstones or biliary atresia or tumor in the biliary tract or carcinoma at the head of the pancreas. So these are the three types of jaundice, that is prehepatic and hepatic and post-hepatic, and these three can be detected by Vandenberg's reaction. Okay. So urobilinogen in feces and urine. So conjugated bilirubin is excreted via bile salts in intestine, and bacteria in the intestine break down bilirubin to urobilinogen for excretion in the feces. So normal value for fecal urobilinogen is 42 to 80 milligram per day. So normally there are like small traces of urobilinogen in the urine. So average is 0.64 milligram and maximum normal value is 4 milligram per 24 hours. Okay. So bilirubin in urine. So bilirubin is not normally present in urine and feces since bacteria in intestine reduce it to urobilinogen. Okay. So the kidneys do not filter unconjugated bilirubin because of its binding to albumin, and conjugated bilirubin can pass through glomerular filtrate. And bilirubin is found in the urine in case of obstructive jaundice due to various causes, and in case of cholestasis. So bilirubin in urine may be detected even before the clinical jaundice, that is even before the yellow coloration of eye or skin is observed. So urobilinogen can be identified in urine by Ehrlich's test. So urobilinogen will react with para-dimethyl amino benzaldehyde in chloroform to give pink colored aldehyde complex. So the reagent required, Ehrlich's reagent, that is a saturated sodium acetate chloroform. So and procedure is 5 ml of urine plus 5 ml of Ehrlich's reagent. So this is mixed and allowed to stand for 10 minutes, and then 5 ml of saturated sodium acetate is added, and 5 ml of chloroform is added, and they are shaken vigorously, and the layers are allowed to separate. If the pink color appears in the chloroform layer, it indicates the presence of urobilinogen. Okay. So the color can be easily detected when viewed from the top of the test tube. Okay, so bile salts are detected by Hayes sulfur powder test. So bile salts have the property of lowering surface tension. Hence, when sulfur powder is sprinkled to urine containing bile salts, it sinks to the bottom. Okay, so bile pigments can be detected by Fauchett's test. So here bile pigments adhere to the precipitate of barium sulfate and addition of Fauchett's reagent, this that is ferric chloride, in the presence of trichloroacetic acid, it oxidizes yellow color bilirubin to green color biliverdin. Okay, so urinary finding. So in case of prehepatic or hemolytic jaundice, so which is due to breakdown of RBCs, so urobilinogen will be present in urine, bile salts and bile pigments will be absent. In case of hepatic jaundice, so urobilinogen will be normal or less. It might not be detected, but bile salts and bile pigments will be present. In case of post-hepatic jaundice, it is bile salts and bile pigments will be present in very high concentration. That is in case of obstructive jaundice. Okay. So here, when the concentration of blood bilirubin is more than 1 milligram per deciliter, then the condition is known as hyperbilirubinemia. So jaundice refers to the yellow color of the skin and sera caused by deposition of bilirubin. So this is due to increased bilirubin levels in the blood. Okay. So serum bilirubin, so the excretory product, so it is an excretory product, and it is formation is because of catabolism of heme. So there are two types of bilirubin: unconjugated, which is water insoluble; conjugated, that is bilirubin conjugated with glucuronides. And estimation can be done by Vandenberg reactions or reagents: diacetate sulfonic acid, methanol. Okay, so there are three types of jaundice, that is prehepatic, that is hemolytic, which is due to breakdown of heme; hepatic jaundice due to some infections or damage to the liver due to alcoholism or due to drug induced hepatitis; and conjugated, so that is due to obstructive jaundice. Okay, so that is due to obstructive jaundice, which is due to blockage in the biliary tract. Okay, so bilirubin is not normally present in urine and feces, since bacteria in intestine reduce it to urobilinogen. So the kidneys do not filter unconjugated bilirubin because of its binding to albumin. It gets converted to macromolecule. So conjugated bilirubin can pass through the glomerular filtrate. So because it is not bound to protein and it will be a small molecule, and bilirubin is found in the urine in case of obstructive jaundice due to various causes and in cholestasis. So bilirubin in urine may be detected even before clinical jaundice is noted. Okay, so here in case of hepatic jaundice, urobilinogen will be more. In case of that is prehepatic, sorry, in hepatic, bile pigments and bile salts will be present. In post-hepatic or obstructive jaundice, bile salts and bile pigments will be present in a very high concentration. Okay. So thank you so much. So in your next class, we'll discuss about disorders of amino acid metabolism.